Welcome, everyone. Just give us a few minutes to start. Welcome, everyone. My name is Judy Barton with Healthcare for All Minnesota. Welcome to tonight's educational event, Grassroots Organizing to Win the Minnesota Health Plan, with our special guest speaker, Hunter Cantrell. Hunter, did I say your name right?
Yes, you did. Thank you.
Great. Just a few ground rules before we start. First, if everyone can make sure that they are muted, that would be great. That just helps with background noise. So people can hear the Hunter and other people who are speaking tonight. This video is being recorded. And at the end of the event, we will, or tomorrow or early next week, probably we'll send out a link with the recording and any materials presented tonight. So please be on the lookout for that. And for the question and answer period, if you guys could please use the reaction tab on your toolbar for Zoom, there's a reactions. And if you hit that button, it'll pop up and there'll be something that says raise hand. Please put or if you want to ask a question, please use this feature, because if you're raising it in your screen, we won't be able to see you. And with that, I'm going to hand it over to Ann.
Thanks, Judy. Thanks to Judy Barton, our Director of Operations for Healthcare for All Minnesota, for hosting this evening, and welcome to our educational event sponsored by Healthcare for All Minnesota and Physicians for a National Health Program, Minnesota. This is our monthly educational event. So I'm Ann Jones. I'm a retired registered nurse and Vice Chair of Healthcare for All Minnesota and Chair of the Education and Outreach Committee. If you're joining us for the first time this evening, welcome. If you're back to learn more about how to be an advocate for our broken healthcare system, to fix it, welcome back. If you invited someone to join you, extra points, that's organizing. This educational event is sponsored, like I said, by our two organizations, and we wanted to focus on information you can use to help us build our base of support for change. We exist for one reason. That's to fix how we pay for healthcare in this country and make sure that we have a system with everybody in and nobody out. And to get there, we have to educate, organize, and legislate. And that means voters, the public, and elected officials. Organizing, educating all them, and organizing means building our base of support by bringing more people to this fight. That means including individuals and other organizations who are likely to be friendly to this issue. Legislate, of course, means partnering with the legislative elected officials and understanding the legislative process, helping to craft bills that actually reflect good health policy. So again, welcome. These are all the players for this evening. We had people planning this event and we have people helping us pull it off this evening. The plan for our event this evening is that I will make some opening remarks about why we created this particular program. Jean Foreman, retired RN and member of our Education and Outreach Committee and program planner for this event, will introduce our speaker. We plan to have some time for Q&A, and then we're going to go into breakout rooms and, using some very common scenarios, practice what we've learned about grassroots organizing for change. After, we'll do a quick debrief, and then I will have some announcements and a call to action with information on bills that we're supporting this session. And we'll end with a challenge and a wrap-up. To get us started, there's no sugarcoating this. People have been trying to fix how we pay for healthcare for over 100 years in this country. This is not new. And when it comes to single payer financing for healthcare, we believe we have the right policy. We have the economics on our side. We even have public opinion on our side if you ask the question the right way. But we're up against very powerful, well-financed opposition to disrupting the business model of the for-profit side of healthcare. So the medical industrial complex spends more money lobbying Congress and our state legislatures than on their interests than any other industry, including banking and the fossil fuel industry. It takes a massive amount of public support to make change as fundamental as to people's lives as reforming and changing how they experience access to healthcare. So even then, public opinion isn't enough. We have to elect people who will legislate this change, and we have to have their backs. We have serious ideological barriers to overcome. And even though most people know our system is pretty bad, we are up against fear of change that we are going to have to address and make people comfortable with. So each and every one of us can be an activist when it comes to issues we care about. And it isn't just this one, and none of us is born knowing how to organize for social change, but there are skills that can be learned. And that's what this evening is about. Organizing is different from advocacy. Our February event on citizen lobbying was about advocating for the goal of comprehensive, affordable, high-quality, universal healthcare. Organizing is about building the power to effect change. In this case, to win universal single-payer financing for healthcare in Minnesota and in the US. If you are not yet on our mailing list, because maybe somebody invited you or you saw this event on a social media site, please go to our website, which is hca-mn.org, and give us your contact information so we can stay in touch with you. We send out a monthly newsletter. We send out occasional calls to action, as well as opportunities to volunteer to help us move this issue forward. So it's ordinary people like us who will turn public opinion into political will. We do need candidates and office holders who champion and run on change and to make a difference, but advocates for change will have to hold their feet to the fire and have their backs when they step out to support us on this very difficult issue. These are just some of the activities that kind of represent ways to bring more people to the fight and build our base of support. But this evening, we're concentrating mostly on understanding movement building and learning how to have effective one-on-one conversations to bring more people to the fight. So fixing how we pay for healthcare happens only when we, the people, make it inevitable. This will take lots and lots of conversations with our friends, our neighbors, our coworkers, voters, legislators, candidates, business owners, other organizations. So also important are outreach events such as public forums, park events, some of the other stuff on that list about bringing more people to the fight. And we do have a lot of events like that coming up this spring, summer, and fall. If you choose to get involved and show up for these events. So with that, I'm going to ask Jean to introduce our speaker.
Hey, thank you, Ann. It is my pleasure. I'm Jean Foreman, retired RN, like Ann mentioned, and also a proud M&A member. I want to introduce a friend of mine who I've known since he was a candidate in neighboring Savage, Minnesota, when it was 56B. Which is now 55B, but I'm next door neighbor in 55A, and really proud to have known Hunter through his candidacy, his time in the legislature, where he just tore it up, and then on to representing nurses at the Minnesota Nurses Association. He's now an incoming medical student at the U of M Twin Cities. And I know he's going to do great things there, both as a student, as a doctor, and as an organizer. So please, I'd like you all to meet a friend of mine, Hunter Cantrell. Hunter.
Well, thank you so much, Jean, for that incredible introduction. It's I certainly cherish your friendship and everything you do to fight for working people and to fight for healthcare. So hello, everyone. My name is Hunter Cantrell. I am enjoying the beautiful sunshine that we have today, our instant summer, as it were. And a quick anecdote before we get going here. I was just sitting out on my deck here minutes before the beginning of this meeting. Then I noticed that my next door neighbors walked up their back staircase leading to their deck. And then they came down and waved at me, and I waved at them. And then they said, can you climb in through our kitchen window? So and unlock the door for us. And I said, absolutely. So, it's something about being in the right place at the right time. But so it was an eventful day. But my name is Hunter Cantrell. I am a retired member of the Minnesota House of Representatives. I had the honor of representing all of Savage in the northwest part of Burnsville while I was serving in the House. I wanted to tell you guys, I think starting off a little bit about why I chose to run. So I was 23 years old when I announced my candidacy, and I had just gone through 6 of the hardest months of my life. I was diagnosed with Hodgkin's lymphoma stage 2 when I was just about to turn 22, and had to undergo several months of chemotherapy for that. So I lost all of my hair, lost my eyebrows, lost it. It was with the most trying experience that I'd ever endured. To add to that, it just so happened that the U.S. Congress at the time, which was completely controlled by the Republican Party, was voting to repeal the Affordable Care Act without a replacement. Now, I knew that if this were to come to pass, then that would mean that millions of people throughout the country and likely hundreds of thousands, if not millions of Minnesotans, would then be left without care, as there wouldn't be any protections for people who are over the age of 18 to stay on their parents' health insurance any longer. There would be no protections for people with pre-existing conditions, which is pretty darn near close to all of us. And my continuity of care and the continuity of care of many other people living with chronic conditions would have been jeopardized. So as I was watching this unfold, I knew that I had to do something. I felt really a sincere calling to do what I could in my capacity, just as a citizen, to have conversations with people and to try to make sure that everybody was able to get the health care that they need. So it wasn't until I had a 10-day hospitalization in October of 2017 that for a near fatal reaction on my chemotherapy drugs, that I made a promise that I would devote the rest of my life to ensuring that everybody was able to get the care that saved my life and that is so life-sustaining and so essential for each and every one of us. And that has been turned into a money-making mechanism and really a vehicle for greed for these private companies over the backs of patients and taxpayers. And so it turns out, I walked out of that hospital and about a week later, I announced my candidacy for the House of Representatives. And I knew it was going to be an uphill fight, right? And I knew that this district had never voted for a Democrat before, but I viewed and I continue to view the work of improving people's lives as being inherently nonpartisan. So it's I believe that at the end of the day, much like in the labor movement, right? It doesn't necessarily matter if somebody leans conservative or liberal or any of that. What matters is when working people come together and say enough is enough. That is when change happens. And so, I'll pull a piece from the labor movement, my time in the labor movement. I was part of the first round of, or I was part of the group of personal care assistants in, I believe, 2014 that signed on to ratify or to certify our SEIU Home Healthcare Workers Union. I was 19 years old at the time, and I recognized the importance of making sure that workers come together, that working people come together, and because the inevitable result of that is it was bolstering the workforce of caregivers, and therefore improving the quality of care and the access to care for people who need home health care. Okay, so that I wanted to emphasize that point very early on in this in our conversation tonight, because as we think about how we're going to build community, how we're going to mobilize people around this really critical issue of making sure that people are able to get healthcare without costs continuing to go higher and higher and higher and higher to unaccountable private companies. We need to have, I think, at the very center of our focus, this idea that people come from all different walks of life, have all different lived experiences, but at the end of the day, we are all working people, and we are bound to encounter disagreements that we have with folks. That's something that I encountered quite a bit when I was running as a candidate and when I was serving the legislature. But I encourage all of us in this movement for universal health care, universal coverage, that we don't view people's skepticism, that we don't view people's different viewpoints as obstacles, but rather opportunities to grow together and to build community and to find ways that we can work towards common ground. And so that is something that I think was absolutely essential for my victory in flipping this state House seat. It was about 10 percentage points in the election of 2018 when I was elected. Is because honestly, working people throughout our state, throughout our country, have gotten just the most raw deal. Is these private corporations have made more and more money off of our hard work, while more and more of us suffer and have to live with less. And so that's what's at the real heart, I think, of this fight for healthcare, and this fight for making sure that not a single Minnesotan more has to worry about losing their house, has to worry about interruptions to the continuity of their healthcare because they lose a job, because they change jobs, because they no longer are able to work, and ensuring that ultimately we are moving forward is working people rather than with the I think preconceived notions that a lot of folks have around universal health care. Oh, Charles, would you mind muting your mic, please? All right, there you go. You're muted, sir. And so kind of furthermore to that point, right? When we're thinking about what it means to organize and what it means to talk to each other about how we make improvements in this movement for healthcare, we have to think about, how do we share stories? How do we reach people where? Sorry, just one second. How do we reach people where they are at? Because we have to acknowledge that there's a few conflating factors here. One is that the vast majority of people throughout this country have never really seen a return on the investment, a direct return on their investment from the taxes that they pay, right? And so if we are to say, well, yes, trust the government with your healthcare, trust the government with an increased tax for handling your healthcare, then we need to make sure that that system is designed in such a way that it is efficient, effective, accessible. And in conversations that we're having around organizing or healthcare reform, we need to bridge the gap and have conversations about how a system of universal coverage is a vast improvement and is feasible compared to our current system. Because I think a lot of folks are still under the impression that universal healthcare is socialized medicine. What a lot of folks don't know is that the American Medical Association itself, which is now, I would say, has been reformed, but the American Medical Association itself in the 70s and in the 80s, actually even prior to that, was the organization that was most responsible for spreading the myth that universal healthcare was socialized medicine and stoking that fear. And so we have to acknowledge that people do have fear around universal healthcare, but we need to be having conversations with people about how the current system is not sustainable. It is not, throwing hundreds of millions of dollars at health insurance companies every few years for reinsurance is not sustainable. I think there's a statistic out there that somewhere around 2/3 of our healthcare is already publicly funded. And and when people are on Medicare, when people are on Medicaid, they are able to get the care that they need. They're able to have highly portable, highly reliable health insurance that they need free of charge. And so we have seen it already work at smaller scales in this country. And I frankly believe, and I think that part of the really critical way that we need to think about this conversation is that this is the United States of America. Anything is possible. We are the single wealthiest country on the face of the planet. What we have is not a resources issue, it's a misallocation issue. So we have resources that we can be investing in universal coverage, in universal access to reduce cost prescription drugs, but we need a combination of two things. We need political will to do so, and we need to make sure that the resources that we are currently investing that go to health insurance companies that are unaccountable to the people and that continue to not only increase our profits year over year, but also continue to add middle managers and add multiple opportunities for continuous skimming off the top of our money that goes to our premiums, our deductibles, and is given to these companies in the form of reinsurance, which is essentially a redistribution of people's tax dollars to private industries that aren't accountable to the taxpayers. So we need to think about this in a multitude of different ways. And I implore you, as we're thinking about movement building, right? When I was, both running for office and in the work that I've done in the labor movement, I encourage people. There are conservatives, there are liberals, there are people across the board who I met in the labor movement who say, you know what, I maybe not, I'm not a lefty, I'm not a liberal. In fact, I actually know a few very conservative people who were the staunchest supporters of the union because they are the union. And that's what we need to think about when we're thinking about how to win healthcare reform, is that we are all just people working together. We are human beings who have for too long suffered from the inequities, suffered from, frankly, the greed in our healthcare system that has deprived so many of us and so many of our friends and loved ones and neighbors of the life-sustaining and life-saving care to which we all deserve. It is not a commodity. It is not something like a hot tub or a car that fluctuates in price and is a luxury item. It is something that people's very lives and existence depend on. And I think that that's the way that that this conversation needs to be framed. Is at the end of the day, nobody is happy with their health insurance costs. Nobody, except perhaps if you are on Medicare, or if you are on a heavily subsidized program and your costs are minimal. But the vast majority of people are not happy with the direction that health insurance costs are going, and the continuous year after year deprivation of coverage, denial of coverage, increasing co-pays, the multitude of ways that health insurance companies find new ways to make money off of this is necessity that we all rely on and depend on. And so I think approaching the conversation from the idea of we are all in this together, and that's how you build a movement around healthcare reform. You show up to the Capitol, you show up at events, you write letters to the editor, you have the conversation, and you keep having the conversation in public, and you keep building coalitions with people so that everybody feels enfranchised into this movement. We're in an era of I think hyperpartisanship, and I never want to sound like I'm both siding things, but I think we're in this era of hyperpartisanship. But what I saw firsthand when I was on the campaign trail, and still when I still door knock for candidates and have conversations with people who maybe aren't 100% ideologically aligned with myself, is that there are some real, sincere, down-to-earth human issues that unite us all. And if we dare to have conversations and build community with each other, we can actually achieve the outcomes that we're pursuing with healthcare reform by making sure that instead of our money being wasted on these health insurance companies, where their CEOs have millions of dollars in benefit packages, where their revenue continues to increase year over year, we can make sure that tax money, that our hard-earned money, that normally goes to premiums and deductibles, is being more efficiently, effectively, and more monetarily in a way that is more monetarily sound, in a universal system of coverage that actually suits our needs, because it would be fundamentally accountable to the people and invested in as a public good. Much in the same way that we invest in our schools and our roads. These are things that I know that public schools, I don't know if roads have ever been called socialist, but public schools were once called, or public high school, I think specifically, was once called socialist. And it's really, we need to start thinking about the idea of universal coverage, because I think the majority of people understand this as just a public good. That is a way more effective investment and use of our monetary resources than we are currently investing them as it stands with our with our private for-profit, even though a lot of them are organized nonprofits, but private health insurance scheme that we have. And I'll share with you guys too. I don't know if a lot of folks know this, but when I was serving in the House, I served on a few committees, but I served on the Health and Human Services Finance Committee, and so we had oversight of the health insurance companies, of hospitals, so on and so forth, and all really fiscal health policy. And one of the things that was quite apparent when I was on that committee was that there are a lot of ways that health insurance companies move money around, including to for-profit subsidiaries in other states. So we have money that is being filtered out of Minnesota. Premiums continue to go up. And it wasn't until I believe 2019 or 2020 that Minnesota, which was the final state where health insurance companies, particularly HMOs, had to be organized as nonprofits in order to sell health insurance products. Minnesota was the last state that had that nonprofit requirement for HMOs. In 2020, that requirement ended. There had been a moratorium instituted by Governor Dayton in, I believe it was either 2017 or 2018. And then that moratorium ended. And so now we have this added factor of for-profit entities like United Health being able to sell health insurance products in Minnesota. And we need to make sure that that folks know that if we are to prevent health insurance companies from continuing to skim more and more off the top, from taking more and more of our money while providing less and less, because there is very little actual regulation of not only the requirements for price for maintaining price inflation, for maintaining coverage availability, but there's very little accountability, period, for when especially for-profit health insurance entities deprive people of care. I think a lot of people have seen there's a certain for-profit health insurance entity that is always in the news because there's something scandalous that comes out about, here's another $100 million in profit they made. Here's a phone call where someone was deprived care, and the people working for this health insurance company were laughing about depriving this patient of care. It is a fundamentally inhumane infrastructure that we have for healthcare as it stands today in Minnesota. And so I think at the heart of this, we can talk about, and I think it's true that this is a fundamental push for human dignity, for accessibility, for people's very lives to be the focus and at the center of our healthcare system in our state. And by I think centering that and focusing on that and having conversations with our friends, with our neighbors, with our loved ones, with people who maybe might not always be on board with 100% ideologically in line, by having the conversations with that idea, with those principles in mind, we can actually cause change. We can actually reform healthcare, because there is a reason why no other country on the face of the planet has the same healthcare system that we do. And that's just because we pay twice as much and have abysmal outcomes than many industrialized countries. And frankly, in a lot of ways, coverage and care and patient outcomes are getting worse. And so I say, as a future physician myself, at the heart of what we do is people. We need to think about how we can improve our shared mutual human condition, because that's ultimately what universal healthcare coverage is. It's an investment in improving our shared universal human condition. So I know I'm at about 7. Okay, I've been talking for maybe a half hour now. Anne, would you like me to keep going, or is it Q&A time?
We have till, let's say, 7:25, 7:20, 7:20. You have like 10 or 15 more minutes if you choose to use that to talk about organizing and movement building. And then we have a few minutes for questions, kind of your experiences in campaign organizing and maybe labor organizing and movement building. And I will share with some people one of the reasons Jean and I wanted to do this talk is that movement building is hard, mm-hmm. but we think there are some skills we can learn, and we'd like to have you share some thoughts about that.
Absolutely. Thank you. Yeah. So, movement building is challenging. And what they say, anything worth doing is challenging. We live in a system that in a society where there are all sorts of incentives against humanizing our neighbors and humanizing our who we consider to be our ideological opposites. And there's a real, I think that there's a real undercurrent of societal forces that kind of push us away from coming together and organizing and causing change, because these wealthy companies, these wealthy health insurance companies, know that there are a lot more people who are really, really sick of how they operate than there are, executives at health insurance companies. And so that's something I wanted to touch on too, just as kind of a backdrop as we start to talk about movement building in that conversation. Is that when I was at the Capitol, and I know that this is true now, there were tons of health insurance lobbyists there, health insurance company lobbyists. They testified against almost every bill I brought forward. And that's because they knew that they were going to face added accountability and added scrutiny if these bills passed. Now, there's still some, I'm trying to think of any that, there's actually quite a few still out there. I'll give you an example. Currently in Minnesota, it is legal for let's say you sign up with a specific health insurance company with a specific health plan for a contract year because they cover the one epilepsy medication that works for you. It is currently legal, and I tried to outlaw this with the bill, but it's currently legal for that health insurance company, let's say 3 months into the contract year, to say, oh, we're really sorry, we're not going to cover this one drug that works for you anymore. And then say, and then take away coverage of this really critical drug that you need. And in fact, this happened to a former Republican state representative who is my second author on this bill. Oh, Linda, I'm sorry to hear that happened to you this year. Right. A lot of folks have had experience with this. And then you're just stuck in this contract. It is an inherently exploitative system. And so the health insurance companies all teamed up. They somehow health insurance costs keep going up, but they have all this money for lobbyists. To me, in CEO compensation, but that's an executive compensation, but that's a separate topic. But they spend all this money. I think it was somewhere in the millions. I know it was over $1 million. I think just alone to fight against the Alex Smith Emergency Insulin Act when that was going to the legislature. But they spend a ton of money, a ton of time trying to influence legislatures, trying to influence legislation. And I'd hate to break it to everyone, but they're not there advocating for us. They're advocating for the legislature to help reduce the cost of premiums. Rather, what they do is they go in there and they try to block any form of accountability, any form of anti-price gouging legislation that would rein in the costs that continue to escalate and put people out of house and home for working and retired Minnesotans. And they're there to make sure that they get to keep as much of the pie and actually expand as much of the pie that they get, as much of the fiscal pie that they get as possible. And so thinking about mobilizing, thinking about building a movement around fighting for and winning universal health care coverage, you got to know that there are people working, there are health insurance lobbyists, these dark money special interest groups working day in and day out to try to influence, members of the legislature against your best interests and against the best interests of Minnesotans. And so, there is a real sense of urgency around being not just advocates, but really enfranchising people into this movement. And so I think, when I think about my time as a candidate, right? Like I said, I lived in a district that hadn't voted for a Democrat before, but I have a lot of family members who are conservatives who see how their health insurance costs, continue to increase again and again and again. How their coverage for prescription drugs, if their prescription drug prices aren't increasing, which they almost always are, then coverage is changing and shrinking, and just it creates an instability that is unifying, or rather unified and shared experience between all of us, regardless of our political stripes. And so I think that there is a real opportunity to talk to people, just based on the issue of how do we reform healthcare so that our money is actually going to pay for the direct cost of our care, rather than going into some executive's wallet, going into some company's overhead, and away to all these different offshoots, away from actually being a return on the investment of the money that we invest, because that we expect that out of every other service, right? You expect to pay a reasonable price for a service to be rendered, especially one that is a life-saving service. So, when I was campaigning, one of the things that I really focused on was not going up to someone's doorstep and saying, "This is what I believe. This is, what do you think?" You would get to that eventually, but I would start out with, "Hey, I want to represent you. What do you care about? What do you care about?" And that's because that's a human question. That's not a Democrat, Republican, you versus me, whatever question. That's just a human question about, hey, what are some of the things on your mind? Maybe we have some shared experiences. Maybe we can figure out some solutions together and solve some problems, because that's the only way that anything's ever gotten done. That's the only way that the American people, and people in general, have ever been able to wrest power away from unaccountable people and institutions and organizations in positions of power that actively harm us in a lot of ways, in my opinion. So I think that when it comes to yeah, I care about having a corporation run by a billionaire decide what, if any, healthcare I get. Yeah, right, right. And that's essentially our healthcare system, quote unquote, in a nutshell. And no one's really happy with how it's functioning, right? I think almost across the board, people love their care providers, right? We especially in Minnesota, we have some of the best care providers in the country. And I've had the pleasure to work with and be the patient to many of them. And so people love their care providers. What they don't love is having to, like I think it was Henry said, what they don't like is having their healthcare rationed by these health insurance companies that they're giving all this money to, and to an increasing extent as time goes on. And so I think I think that's a really critical piece, is just seeking to have an open and honest dialogue with people, anyone who will listen, and attaching, action items to that. Hey, I'm going up to the Capitol to meet with our state legislator. Have you ever done that before? You want to come with me and you want to talk about, your experiences with healthcare? Stories are the single most powerful thing that we can share together. I love sharing my cancer story because it was one of the most traumatic, but also one of the most profound experiences of my life that really crystallized to me at an early age. That the instability inherent in our healthcare system could easily become much more unstable, given however the political winds change at the federal level. But also, we're all in a certain form of jeopardy every day because of the way that our healthcare system is set up. I saw that, without. I will say my mom was herself an M&A nurse at the time that I was going through chemotherapy and all this treatment. I was admitted to the ICU when I was hospitalized for 10 days. And I didn't spend 10 days in the ICU, but I spent a one or two. The rest was in the hospital. But, I saw the cost of my care after all was said and done. And, we were very fortunate because the Affordable Care Act allowed me to stay on my mom's health insurance, even because I was 21. But also, we couldn't be kicked off because I had a pre-existing condition. And every year we see more and more people at the national level, and there are people in state government too, who talk about kicking people off of Medicare, kicking people off of health insurance, finding ways to put us in even greater jeopardy in an already unstable system. And so I think that's a shared experience for the vast many of us. Is I think almost everyone has had an experience where they've had to delay getting a hip replaced, had to delay medication, had to start a GoFundMe page, in the richest country on earth, where health insurance companies make hundreds of percents in profits year over year. And we have people making a GoFundMe page because of the cost of their care. And I really strongly believe that it doesn't matter, where you come from on a political basis. But I think that's something that everybody, if we have conversations with each other and just really talk about what is at stake and the lives and the suffering that have been caused by our healthcare system, I think that that is something that is so unifying. I think it is so strong. I think it cuts through fear. I think it cuts through division. I think that we can have those conversations. We can do that hard work of movement building, one conversation, one story at a time, having events, talking to legislators, writing a letter to the editor, doing what it takes to make sure that people, to help to educate people, to help to have a conversation, assuage concerns. Because every time that there has been healthcare reform, I not maybe entirely, but oftentimes when there is healthcare reform, because in my opinion, the health insurance companies have been involved, it ends up falling flat. It ends up causing even more distrust among people, and I recognize that. I think that's valid. And so I think when we look at the future of healthcare, we need to look at really what is at stake, and what are ways that we can unite our shared humanity, our shared suffering, and our shared dreams in making sure that everyone is able to get the healthcare that they need, rather than our money going to these companies that are run by billionaires that take more and more of our money and give us less and less. And with that, I think we're at time.
So I wonder, before we open it up to questions from everybody, I wonder if you could just comment a little bit, and I will say this from the point of view of something I think I learned as kind of organizing 101, is that the importance of having conversations and being kind of alert to those opportunities. But then what? Then what? We've got lots of people on our mailing list, but who we try to communicate with electronically anyway. Talk about the importance of following up.
Yeah, no, it's critical to follow up. It's critical to, have that conversation about the why, and then start to brainstorm and think about the how. What is that conversation going to turn into the next step? What are the action items that we can take? And folks are busy, right? There's a lot going on, but I think we all can do our part to a certain extent, whether that is a letter to the editor, a letter to your state legislator, a letter to, or going up to the Capitol and talk to your legislator, holding a meeting, inviting your legislator to maybe a coffee hour or something. There's all sorts of creative ways, I think, to build community awareness, and start to implement action items to win healthcare reform, that can be next steps, and are really critical next steps, after having the conversations and sharing stories with people.
So let's take the next 10 minutes, and we'll let anyone who has a question go ahead and direct it directly to Hunter. And John Cross, I see you first. Go ahead.
Hold on, Anne. I just want to remind people to use the raise hand feature under the reactions to ask questions.
Thanks, Anne, and Hunter, thank you for that presentation. I'm a semi-retired pathologist, but believe it or not, the university still lets me teach at the university, and I'm just looking so much forward to having you in the first year class.
Thank you.
It's going to make a lot of difference. So I'm really glad you're going to be joining us.
I appreciate that, Dr. Crossan.
The question I have is, your story is very compelling. How come everybody in the state legislature doesn't understand that we absolutely have to have John Marty's Minnesota health plan?
That's a great question. I think, and I was talking to Ann and Jean about this the other day, right? I think ranked choice voting is a good example to touch on here, because ranked choice voting is, I think it's a good reform, but it was one that was fairly obscure a few years ago, right?
Mm-hmm.
And took years and years of persistent, almost omnipresent activism and advocacy from folks to become at the forefront of the legislature, to the point now where it's moving through committees and it's being
Right.
and it is being considered by the legislature. So I think that there's a confluence of factors here. I think that there's more movement building that needs to be done in order to make healthcare reform of this magnitude seem both feasible and viable at a state level. And that's organizing. I think back to when I was just getting my start as an activist, calling people throughout the state of Minnesota who I can't remember exactly if they were independent voters or not, but calling people throughout the state of Minnesota, asking them to contact their legislators, have a conversation about marriage equality, and ask them, that kind of district by district, statewide, geographically, socioeconomically diverse organizing, where legislators do pay attention when people show up consistently and when their constituents are contacting them about certain issues. And so, the Minnesota Health Plan, I think, is one of those things. I think that there needs to be more robust advocacy. I think now is the time to do it. But I also think that frankly speaking, legislators are not experts in health policy. Most of them. There are some, certainly. But everyone goes to the legislature with different lived experiences and with different policy foci. And so I think there's a lot of education that needs to happen. I think, frankly speaking, I think that it would be good to have some town halls. I think about the cannabis bill, for example, was the result of work throughout the state of Minnesota, having town halls, compiling feedback from people, and then making a really comprehensive bill. And I think that that kind of approach would be actually pretty beneficial to building not only statewide support, but also building legislative support for such an idea, because the net result is a fully fleshed out transition and just transition to not only universal coverage, but a type of universal coverage where people see their own lives and values and experiences reflected in the way that it's composed and administered. Because I think a lot of people are anxious about such an idea. I think that everyone wants better healthcare, but I think a lot of people have a lot of anxiety about, am I going to be able to keep my doctor? Is this actually going to work? Am I just going to pay more and have worse coverage? What about, the long waits in Canada? Never mind that it takes, 2 to 3 months to get into a psychiatrist or psychologist sometimes. So I would say that's my long answer, Dr. Crossan.
Next we have Amy. Amy, you can unmute yourself.
Hi, my question is, well, I'll just tell you, I was talking about healthcare to 2 friends yesterday, one far left, one far right, and both of them, they had a very lack of trust in the government. And when I start mentioning the Minnesota Health Plan, they just, when you start talking about the government getting involved, they just get very discouraged. And my question to you, Hunter, is how do you, or what did you experience when you were talking to people? Did you encounter people that just didn't want to deal with you because they didn't believe in the government and they just had given up? And I guess how did you deal with those kind of people when you were knocking on doors? People that just said, oh, the government, they're no good, they don't do anything. That's my question. Yeah, no, that's a great question. It's a profound question, right? Because I can't say I fault them. Personally, there are certain aspects of the government that I'm skeptical of and that I distrust. Especially at that time when I was running, right? It was when my healthcare had just almost been stripped away from me. And so asking people to put more faith in the government can be a tall order. And, the underlying, I think, pathology of that is that a lot of people have never felt like the government actually helped them when they needed help. And I think that for a lot of folks, COVID
in the COVID relief stimuli were the first times that they ever felt like the government had their back. And so I think that that's kind of at the heart. I think that that's just a good way to maybe understand some of the underlying suspicion around government and government involvement in things. And because, the government has fumbled, the government is essential, right? It's, we need public goods, we need roads and bridges and schools and all that fun stuff. But I think that there is a little bit, there's a certain extent of understandable mistrust that people have with giving that much authority to the government over such critical services as healthcare. And so when I was running, right, because I heard that quite a bit, I think and when we have conversations around movement building, period, I think it's essential to be empathetic to where people are coming from and really understand where that suspicion is, and because that helps us to build, an idea of how can we talk to somebody about how this is different than maybe what their underlying impression is about what the government does and how the government would handle something as essential as healthcare. And that's why, as I was talking, or as I said to Dr. Crossan, I think having town halls and legislators having town halls around the development, the actual nuts and bolts of the Minnesota Health Plan and understanding those concerns and having an open dialogue is so critical, because I think that there is a lot of distrust. I think because of the way that political headwinds have gone back and forth, I understand people's apprehension. I sincerely do. So I think that it's incumbent on legislators, but I also think it's incumbent on us to really understand where people are coming from, and then to find ways that to identify how or not identify, but underscore how this would be an improvement overall as the antithesis to that skepticism and concern that people have for there being a universal form of healthcare coverage.
Thank you. One more question, Dr. Ken Engelhardt.
Yeah, hi, Hunter. Thank you for your insights. Useful information, appreciate it. So what I'm going to ask about is related to the question Dr. Crossan asked and someone else asked about being cynical of the government. So, you mentioned that the health insurance corporations spend millions of dollars on an army of lobbyists that they send to the state capitol and also on the federal level. It's pretty apparent to me, that on the federal level, there's a lot of corruption. Politicians are essentially bought off by corporations, a lot of dark money. Citizens United really hurt things as far as having honest people represent the people instead of being owned by corporations. So the question I have for you is, what influence do these lobbyists have on Minnesota senators and representatives? And are there limits to the amount of campaign funds that corporations can contribute to Minnesota elected officials?
Wow, thank you, Dr. Engelhardt. That's a phenomenal question. Kind of at a baseline, corporations aren't able to give money directly to candidates. However, they do spend a lot of money and have to disclose that money. Although we have a far from comprehensive system of public campaign finance reporting and accountability for who is funding commercials that you see on TV, mailers you get in the mail, and so on. So these organizations through super PACs and through funding of super PACs do absolutely spend money on Minnesota elections and on Minnesota local races. And will spend money. Maybe they'll donate directly to caucuses, or their PACs might give money to candidates, because PACs can give money to candidates, but corporations themselves can't give direct money. And so there is no limit on the amount of money that they can spend. If they are a super PAC spending money on advertising for the Citizens United decision, they can spend an unlimited amount of money without declaring their donors. Now they can only give as either individual lobbyists or super PACs. They can only give, or PACs, they can only give up to $1,000 in that to each candidate, and then somewhere in the ballpark, I can't remember at the top of my head, around $10,000 to $13,000 candidates can accept in total from PACs and from lobbyists. And so, that I would say is that's a part of how they spend money, but they also, like you mentioned, Dr. Engelhardt, spend a lot of money on sending lobbyists to the Capitol. And I would argue that, I think that this DFL majority and Governor Walz have done a phenomenal job fighting for working Minnesotans and are not beholden to special interest groups. What I will say generally is that in my opinion, what these health insurance companies try to do with their high-paid lobbyists that they send to the Capitol, try and stump against any bills that improve healthcare access or reduce healthcare costs for us, is they'll try to muddy the waters. That's really where a lot of this comes from, is muddying the waters, and they'll try and get people to go and testify in addition to the lobbyists that they send. But they will try to again, because I've seen it firsthand on many of the bills that had bipartisan support that I authored, where the health insurance companies and big pharma came in and sent their lobbyists to go meet with my colleagues to testify in committee to try and stoke fear, because that's ultimately all they have is to work with is fear. And so I think as much as we can cut through that fear, both with members of the legislature and with our friends and neighbors as a whole, that is the single most powerful action that we can take. And that's what movement building is all about, I believe, is they can have $100 million to spend against you, but if you are building a movement and you're connecting with people on a human level, and you are dispelling the fear and taking the time to have the tough conversations, and then going and advocating just as a constituent, because those health insurance companies can't vote, that on a consistent basis, consistency, I should say, in advocacy is absolutely critical. That is the single most powerful tool that just we as people have against the dark money forces of health insurance companies, of our healthcare industry, that will spend so much of our money not on taking care of us, but advocating actively against us and for their own best interest. So I hope that answered your question to some extent, Dr. Engelhardt.
So thank you, everybody. I think we're almost to our time in the program, where we're going to split up into breakout rooms with, we have 6 facilitators: Michael Faddis, Dave Garibaldi, me, Jean Foreman, Hunter Cantrell, and Don Pilkinen. And while Judy's setting up our breakout rooms, I'll go over the 3 scenarios that we would like you to practice. Pick 2, and let me see if I can share my screen again and practice some of what Hunter is emphasizing is our path to power, path to building the people power we need to make this change. Can everyone see the scenarios that we created? We came up with, Gina and I came up with 3 really pretty commonly encountered types of conversations. As you can imagine, in the few years that I've been interacting with the public on this issue, I've talked to a lot of people on this. And scenario 1, and we thought we've asked facilitators to make sure that everybody gets a chance to respond to at least 1 or practice 1, if not 2 scenarios. And what our goal is to acknowledge the pain and problems that people are expressing to you when they do talk to you about this very personal issue, but also try to work the conversation around to inviting them to help us fix it. So in scenario 1, you're talking with a friend, neighbor, coworker, family member, and somebody brings up a recent medical bill. Because their plan has a deductible of several $1,000s, this is going to be all out of pocket for their family. We'd like you to practice a response that leads to a conversation about inviting them to help us change this, see if they'd like to help us change this for themselves and for all of us. In scenario 2, you're talking to someone who has just lost their job and their health insurance benefit with it. As they try to find coverage, they learn that COBRA and private insurance are just too expensive. We'd like you to practice a response that acknowledges the dilemma, but try to shift the conversation to how we prevent this from happening again. Or scenario 3, and Hunter already mentioned this, you find out that someone you know has gotten a devastating diagnosis and is trying to set up a GoFundMe page to help pay the bills. This is literally the single most common reason for people to set up GoFundMe pages. Practice a response that acknowledges the need, but also leads to an opportunity to participate in fixing this shameful fact of life under our multi-payer system. Our facilitators each have these scenarios written down if you forget. So you'll probably recognize these, and you may have even had conversations like this with people in your lives. I think what our goal is to say it doesn't have to be this way. That's why we are activists and advocates on this subject. So I'll close down the screen again and stop sharing and bring up.
Great. I am going to go ahead and open up the breakout rooms then, Anne, and everyone should be automatically put into one.
So
Got to restart the recording.
okay. All right. Thank you. Let me
Welcome back, everyone.
thank you. We budgeted a few minutes for people to share if they felt they had any particularly good conversations. I know this is role play is a little difficult and it doesn't always feel really natural, but practicing a skill is always useful, I think. And this is a key skill to build this movement. So did anyone have any conversations they would like to share or questions they came up with?
Our group focused on how when a person is in a kind of a crisis that they're exhibiting from those scenarios, that might not be the best time to try to engage them. That perhaps the only thing to do, or the best thing to do in that situation, is to describe how you're approaching it, what you're doing, how you're helping in that area, and perhaps given time, then they can recall back. They can focus on that as a step.
Okay.
No, that's good.
Right. We don't we didn't want to imply that our only goal is recruiting. We want to acknowledge a crisis, but we also want to be alert to an opportunity that if somebody sees this, sometimes there's a lot of apathy out there that if it hasn't happened to you, you're not sort of moved to take action. When you've had a personal epiphany that this is not working, there might be an opportunity there.
Yeah, and might I add, I'm sorry to interrupt, but just kind of on that same kind of vein of thought, this was a conversation that we had in our group, and it was really good. That of course, empathy is the most important thing that you can show somebody experiencing a crisis, especially in the realm of healthcare. But we were talking about how for so long our society, there's been an overlying theme of messages from corporations, from advertisement, from media in our society that one should feel shame for seeking help, for needing help, and I think that it's almost by design that the health insurance companies want us to feel powerless. And so being empathetic and being supportive of people experiencing crisis, and of course always building trust and immersing each other in our like shared humanity and sharing our stories. That is where our power lies. And so part of what we talked about was like, if someone's experiencing a crisis, or they're worried about affording the cost of their care, or there's a devastating diagnosis and they need to go fund me, having that of course acknowledging the crisis. And then as time goes on, people often feel defeated and helpless. And I think we would all do better to help to articulate to people that no, we aren't helpless. We are strong together. And I've seen it time and time again where people come to the legislature, just patients, everyday people come to the legislature and talk directly to bill about bills in committee and say, you know what, no, I'm not going to suffer anymore in silence. And so I think we can all do, yes, it can absolutely be exhausting. But we can all do our part to kind of lift each other up and prop each other up so that we don't feel hopeless. Because I think that can be an infinite source of strength, especially, I think about the fight for the Alex Smith Emergency Insulin Act. That was born out of tragedy, and people saying, I'm no longer choosing, I'm choosing to do something. I'm choosing to speak truth to power, and it doesn't matter how much money the health insurance companies and pharmaceutical companies have. But like when we lift each other up and say, lean on my shoulder, we'll go together. We'll fight this fight together. We'll go and talk together. That's where I think real change happens. And I've seen it work. I've seen it happen. So I just wanted to add that from our conversation.
Great. There is an urge to make something positive out of a tragedy. So that's gun violence is an example, and health issues, healthcare. Linda, did I see your hand up, and did you want to?
No.
No, Linda
Oh.
Larson.
Oh, well, kind of
That's a
just
Linda's.
following in what Hunter said. I think I've experienced this with people I know. They'll get upset about something that's happening in the country, and I'll ask them if they've called their senator or their representative, and it's almost like, oh my God, I can't possibly do that. And I'm like, well, you talk to an LA, maybe you even just leave a message. But where I think we as people organizing, we have to remember we're their boss. We pay their salary. They should be working for us. And the unfortunate thing is that we have Citizens United, which is keeping us from gun control. It's keeping us from healthcare. It's keeping us from all kinds of money for education, so on. But I think we need to give ourselves power in addressing, we don't have to be rude, but we can certainly call them out. And we can certainly go face to face with them. It's much since COVID, I feel like too, with our US representatives and senators, they've created a barrier. They tend to still do Zoom calls, blaming it on COVID. And I'm not buying that anymore either. I think they need to start having town hall meetings where we see them eyeball to eyeball.
I have to apologize. I wasn't watching the time very carefully, and I do have some announcements to make at the end. There's one more hand. Bob, did you have something quick to say?
Well, one of the things that's been bugging me for a long time is the fact that even with Medicare, the privately managed Medicare, the C version, is less protective than the original Medicare with a supplement. And that's a good example of where the government is doing a better job than the private insurance.
Thank you for that. We can we may need to be a little bit of a cheerleader for government and give some credit. Well, thanks a lot. Let me go ahead and finish up.
And I just want to quickly ask everyone to mute themselves. That would really help me out.
Okay. Thank you. I put in the slides, and everybody will get the slides with their post-event email. A kind of a quick statement if you need an elevator speech that explains the Minnesota Health Plan. It came up in our conversation that not very many people still know that that there is such a thing as a state-based single payer financing system that we're working for on the way to what we hope would be a national health plan. So this is a description. You can use it, you can modify it, you can even carry it around. It's that so-called elevator speech idea. This is a little bit about our organization, nonprofit issues and advocacy organization, and what our goals and vision are. I'll just mention that, of course, we need activism. Big election coming up in 2024. Might not be too soon to talk about that, but I won't dwell on that. There's a little bit, I've put a slide in here reminding us of the citizen lobbying information from February. These are kind of quick reference on effective interactions with candidates and office holders. I mean, our main thing is we need to build people power, but we also do need to be effective and honest brokers for our issue with our elected officials. We're going to have to pack that capital when we get to the point of having hearings on the bills we really want. Here's some suggestions for what we can do individually and with each other to press our issue forward. And then, oops, I should be in slideshow, shouldn't I? And then that would be, you wouldn't have to watch the clutter. Announcements. Like I said, a big part of organizing is having next steps. Have something you can invite people to attend or join or learn more, or just, put their big toe a little deeper into the water, perhaps, and join us in this movement. One is using social media. Our calendar is usually pretty up to date for meetings and events. Sunday, Dr. Mark Brockie, who is on our Healthcare for All Minnesota board and most recent just outgoing chair, is giving a talk at St. Joan of Arc Church at noon in South Minneapolis, or after the 11 a.m. service. And April 17th to the 23rd is a pretty interesting opportunity. The Healthcare Now, which focuses on the National Medicare for All bill, legislation, is holding a week-long annual conference. Used to be in person, now it's virtual. So there's something every day with a few hours on the weekend of the 22nd and 23rd. You can attend as much or as little as you want, look at the schedule and pick things you're interested in. There is a cost to that one. I put the website on healthcare-now.org. It's $50 for the whole conference. On Tuesday, April 18th at 7 p.m., Dr. Ken Engelhardt, very active with Healthcare for All Minnesota, also is going to be speaking at the Stillwater Library on threats to Medicare, threats to original Medicare, and what we can do about it and what we should do about it. And we will be tabling at that. That's one of those opportunities for volunteer to be a volunteer. If you happen to want to go to that, we'll be having materials out, and that's a good way to practice interacting with the public. On Tuesday, May 9th, we are going to be screening the new film by the Fix It production company, the business owner in Pennsylvania who took this on as a special interest and has made a lot of films and videos we can use when we don't know exactly how to talk about this issue. He's got great videos that we can use to explain what's wrong with our system and how we could fix it, including 40 minutes, 60 minutes, 10 minutes, 11 minutes. Anyway, that's some of the materials that are available to you to help us talk about this. The video is called American Hospitals. I've actually got a flyer on that I can show you. And then Thursday, May 11th will be our monthly second Thursday educational event, and it's going to be on framing and messaging healthcare payment reform. So please read and share our monthly newsletter. Please share our website. These are our social media sites, and here's the addresses for those social media sites. We do need you to spread the message. It's really cheap and easy to send to engage with social media sites and try to like and share and so on. anything you are personally on, please go to our YouTube channel. Everything we've done for programs is stored in videos on our YouTube channel. That's another way to share information or get information from programs that we've done in the past. Let's see. Again, please make sure that you're on our mailing list, you personally, and that you can share mailing list or access to our mailing list to other people who you are trying to bring into this movement. This is the information about that new video called American Hospitals. It's how did hospitals turn from charitable organizations into moneymakers? We've got some partnering organizations. It'll be at the main cinema, Southeast Minneapolis. Seating is limited. I think we are limited to 135 seats total. It'll be free, but we, of course, will always accept donations. And we will have a panel discussion after that. Also, let's see.
And I just put the link to the tickets for the screening in the chat.
Okay.
So people can click it there for it.
Ooh, thank you. Great. And these are websites of kind of other, partner organizations, and kind of the more you know, knowledge is power and confidence, I say, and websites of partners nationally in this movement. And then I'll finish up with a call to action. I've got an explanation on kind of our philosophy on legislative priorities with Healthcare for All Minnesota. We'd love to get this done right now, but it's not going to happen in one session or maybe even 2 sessions. So how do we get there? Are there ways, are there things we can do along the way? Despite the fact that you're probably hearing a lot about this legislative session, it's very busy with a change in the, let's say, the balance of power in the legislature. Lots of things going on. We're not hearing a lot about what's going on with healthcare because there's so many other issues that are kind of taking the stage, but there are things going on that we do support that we think will move us in the right direction. So I've got, the slides really busy. You're going to get this in your email inbox so you can take a look at it. Our priority bill is to get funding and to get started on an analysis of benefits and costs of a universal healthcare system for Minnesota. And the bill numbers are here at the top of the list. We would like to see a bill passed that would allow undocumented persons to access one of our public programs. There is a bill moving has had and this is really an example of citizen activism. This wasn't proposed by a legislator. This was proposed by a scrappy group called Health Policy Associates. Sharon Schmidt was on our call earlier. I may or may not be on the call, but we've had several people really working hard to get this one passed. The idea is to allow recipients of our public programs to opt out of these insurance administered managed care plans and choose their own providers. So this we agree would help get the insurance industry out of our public programs. Tina Liebling has actually proposed a bill also to get the insurance entirely out of our public programs. I don't know, a lot of people may not know that the insurance industry, you often have to go through an insurance company to get access to either medical assistance or Minnesota Care. So of course they're skimming profits. There is a bill being proposed to make sure that health systems that are organized in Minnesota do not allow assets to leave our state, including mHealth Fairview, our University of Minnesota Medical Center. Then we are partnering with COPAL on the Frontline Communities Protection Act, which requires an environmental hazard study in racially diverse neighborhoods prior to infrastructure changes. The Minnesota Health Plan has been reintroduced, and these are the new bill numbers. Senator John Marty on the Senate side, Representative Liz Ryer on the House side. Please do ask your representatives and state senators to support the Minnesota Health Plan. Make sure that they are co-sponsors or listed as co-authors for these bills. And then there are 2 gun violence prevention bills we would appreciate support on. One of our board members is I think, executive director of Protect MN. They've been working really hard on, there were 4 bills proposed originally. 2 are actually moving and have a chance of passing, but there are some holdouts on the Senate side. So these are the bills would require universal background checks for firearms sales and transfers, and extreme risk protection red flag laws. So those are that's the laundry list. Like I said, our top priority would be to get that cost analysis for a universal health care system for Minnesota. So would like that support from our activists. The challenge for each of us is to use what we have learned this evening or been introduced to bring more people to the fight for a just and equitable healthcare system for all of us. And then another thing that we'll send out, just a tool for you to use, is a way to track if you've had some conversations, to keep track of who you've talked to, their contact information. A key to bringing people into this movement is to have somebody they know who they think, is got something to offer and is engaged and interested and will invite. You're more likely to come to something if you're invited by a friend or somebody you know. So if you keep a list of people you've talked to, where you encountered them, and have a way to stay in touch at least periodically, or if you even want to make a list of people you intend to talk to, you think might be willing to get involved, or organizations. We would love to know of organizations we can provide speakers for. So I think, and Judy, you had wanted to make a comment about.
Oh, no, I'm ready to close out. The only thing I want to say is thank you all, everyone, for joining us. As you all know, this Healthcare for All Minnesota and Physicians for a National Health Program Minnesota are volunteer-driven organizations. And while we try and do everything at low of cost as possible, we do have costs that we need to get paid, like Zoom fees, tabling fees, and the such. So if you have the ability to donate, there is a link in the chat for where you can donate to us today. Any amount helps. So if you have the ability, please consider donating.
Thank you. And I think I mentioned, but I want to mention it again. I will send out business cards to anyone who sends me. My contact information is on the last slide that you'll get in your inbox. And please let me know if I can send materials to you. We have printed brochures made up, and we have business cards that have the QR code for our website on the back. Very easy. It's kind of handy to have something in your hand with a tagline on it and how they can stay in touch with you. And Hunter.
Sorry, you got.
Hunter
I
was saying in the mail. Okay.
Yeah, Hunter has one more comment. Go ahead, Hunter.
Yes, thank you, everyone. I just wanted to say too, before we closed out, thank you so much for having me tonight. Thank you so much for your dedication to the work of health equity and health justice. And the road is long, but I know that together in our shared humanity, we can achieve anything. And I just wanted to leave you all with this quote from John Lewis. He said, "When you see something that is not right, not fair, not just, you have to speak up. You have to say something. You have to do something." And you all, I know, are committed to doing something. And just know that that is really an act of human compassion. And so thank you all for having me, and I'll always be with you. So thank you so much.
Thank you for spending the time with us. We really appreciate it. And best of luck to you in starting medical school. That's a journey.
No kidding. Thank you very much.
Thank you, Hunter. And thank you, everyone, for joining us tonight. Again, there will be an email next week following up with the PowerPoint as well as a recording of the video. If you have any questions, never hesitate to contact us at our info@hca-mn.org. And we wish you all a great rest of your evening. Thank you.